Good afternoon, everyone, and welcome. I'm Kim McGrail, and I'm the Director of Research at UBC Health and a professor in the School of Population and Public Health in the Faculty of Medicine. Thanks for joining us today for our next session in the Health After 2020 Dialogue series. Before we start, I would like to acknowledge that the UBC Vancouver Point Grey campus is located on the traditional, ancestral, and unceded territory of the Musqueam people, and the UBC Okanagan campus is located on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation. I'd also like to recognize that UBC's activities take place in community and on unceded, ceded, and traditional territories of 203 First Nations and 38 Métis chartered communities, each possessing their own unique traditions and history on the land that we call British Columbia. I'm joining you today from traditional unceded territory of the Coast Salish people, the Squamish, Tsleil-Waututh, and Musqueam nations. And before introducing our speakers, I would just want to make a few comments about UBC Health and the Health After 2020 program. UBC Health works under the Office of the Vice President of Health, and we recognize the growing need for collaborations to address complex and interconnected problems facing society. We facilitate collaborations across disciplines, faculties, and campuses, as well as with health partners and communities. Our work enables us to improve the ways we collectively train people, the ways we develop knowledge, and how we shape policy. Our ultimate goal is to address inequities and improve systems that foster and support health. Through our initiatives, we aim to foster an active community of health research, practice, and mentorship. The UBC Health Dialogue Series brings together scholars, students, and community partners to discuss important topics related to the health and well-being of society and advance interdisciplinary knowledge translation. Our understanding of the determinants and experience of health and well-being has changed, in part because of the 2020 COVID-19 pandemic, which accelerated some existing trends and put a spotlight on others. We now, of course, are trying to respond to the broad effects of the pandemic. And we have the opportunity to learn from our collective experience and to think differently about how we define and value health, how we understand the complex systems that produce health, and how we rise to the challenge of supporting equity in health across individuals, communities, and societies. So it's in response to this opportunity that UBC Health developed Health After 2020, which is a program designed to support researchers to engage in interdisciplinary collaborations and build a community of UBC Health scholars. Through the development of research collaborations, academic outputs, cross-campus conversations, and open dialogue sessions like the one we're having today, this program convenes and informs people at this point in our society created by the COVID-19 pandemic. 8 interdisciplinary teams have been funded during this inaugural year of Health After 2020 to advance and disseminate their collaborative research, and that includes leading a dialogue session. So today is the next session in our Health After 2020 dialogue series, and it's titled Substance Use Among International Students from Punjab and BC's Lower Mainland, a Mixed Method Study. I'm really very happy to be able to introduce to you our speakers for today, starting with Natasha Puri, who is a clinical assistant professor in the Faculty of Medicine at UBC and medical lead at the Roshni Clinic in Fraser Health. Kulpreet Singh from the South Asia Mental Health Alliance, Gurkirat Singh Nijjar, founder of the Students Overcoming Substance Use Disorder and Addiction Society of Canada, and Dupinder Kaur from One Voice Canada. So please welcome Natasha to start us off.
Thanks so much for that lovely introduction and explaining what Health After 2020 was. We're delighted and honored to kind of be part of the program. And we're really happy to see everyone today at this dialogue session. We're hoping to cover a lot in the hour that we have, so I'm going to jump right on in. I'm going to share my screen for you so that those of you who are visual learners have something to take a look at. So as Kim mentioned, we're talking about substance use among international students from Punjab. And the team that we're working with, she also introduced us. So much like Kim, I also just want to acknowledge that I'm from presenting from unceded and stolen territory of the Coast Salish people. And I thank them for their stewardship and stand in solidarity with the work of decolonization. I have much to learn, and I strive to remain humble, open, and thoughtful on this journey, especially as we're talking about various racialized populations that are settling here on this land. Quickly, there are no major conflicts of interest in this particular talk. So grab your lunch and here we go. Just a quick overview of what we're chatting about. I'll give you a bit of background and context in a whirlwind tour of some knowledge, and then quickly summarize the study, which is not yet complete, unfortunately, for the time of this dialogue presentation. So there's not much to present yet, but I will tell you a little bit about it. And then focus our dialogue time, especially on a panel and some breakout rooms where we can put our heads together around what's going on with substance use for international students. So quickly, here we go into some background and context. First and foremost, just to mention a couple of things about substance use and mental health. They often are talked about together, and it is because, individuals with mental health disorders are twice as likely to have a substance use disorder compared to the general population. And we know that people with substance use disorders are up to 3 times more prone to be diagnosed with a mental illness. So they generally go together. Another kind of key point about substance use right now is the fact that British Columbia is in the midst of an opioid overdose and poisoning crisis. Unregulated opioids that are used by folks who use substances have claimed thousands of lives, and the death toll is continuing to climb. We know that 2021 so far has been the highest year on record with respect to deaths and morbidity and mortality, likely due to COVID exacerbators, as well as a changing and more increasingly toxic supply that is, also combined with other sedatives like benzodiazepines and different analogs of opioids. A little bit, again, about newcomers to Canada, just another complete different topic, but just to sort of bring some context together. We know by 2036, immigrants will represent up to 30% of Canada's population, which is about a 10% increase from 2011. There's several challenges that immigrants and newcomers face, according to various studies and reports, including language barriers, isolation, cultural differences, various stressors around finances, housing and food security, and employment, and then of course phenomena such as racial discrimination. We also know that newcomers, and especially refugees, which is a subcategory of newcomers, they have a greater possibility for post-traumatic stress disorder, anxiety, depression, complicated grief, suicidal ideation. So a whole host of mental health diagnoses have been linked with this population. When it comes to mental health and substance use among newcomers, there's very little research, and we're still trying to, that was one of the intentions of our study, is to try and get some data that's more specific to that. But we do know that immigrants generally have a lower level of alcohol, cigarette, marijuana use compared to their Canadian counterparts. But we know that the longer immigrants stay in Canada, the more the prevalence of use of these substances increases. And that kind of goes along with this idea of the immigrant paradox, where you get healthy folks that are chosen to immigrate based on the immigration laws and rules, but as they stay longer in Canada, their health declines due to various stressors and other influences. So to kind of bring all this together into international students, I will talk about India being one of the largest source countries for international students in Canada at this point in time. You can see on this pie chart that it's almost a third of the international students are from India. And we know that the significant proportion of Indian students are coming from the state of Punjab, especially those that are settling here in the lower mainland. Again, we don't have clear data specific to this population of international students from Punjab, but we know that in general, international students experience stressors such as language barriers, culture shock, intergenerational tensions, that's I think very unique to this population. And it sort of speaks to the idea that there can be tensions with students and their parents who are in their native country because of the sacrifices that parents are making to, support their children to come to Canada and the pressures that come with that for the kids. And then there's also intergenerational tensions when folks land here and live with other family members, aunts, uncles, cousins, and they have to sort of abide by this whole family relationship dynamic that can have tension in it. We also know there's lower self-esteem, racial discrimination, financial and academic stressors. Students can be open to, labor exploitation. And then there's immigration related stressors based on the fact that they're temporary status. They don't have access to basic rights and legal protections sometimes. And sometimes they also hesitate to access the services in Canada due to the fear of consequences from immigration services. So the idea that they're not, permanent residents or that they're on visas here definitely affects and adds to their stress. I wanted to highlight some of these ideas in a little bit more detail based on what we know from our experience in the field in the Lower Mainland. Like I said, there isn't that much published literature, but there's a lot of gray literature on these things, especially within the news. So you'll see some headlines and some news pieces on the slides as I zip through this as well. I wanted to highlight some of the context around the financial challenges and the financial costs that put pressure on some international students from Punjab. We know that Canadian post-secondary schools pay a commission to foreign consultants for every student that they recruit. So that's kind of an interesting structural element that has given rise to an industry that caters to youth wanting to obtain a study visa and settle in Canada. So lots of folks are kind of making money off of this particular structural element in Punjab as well as here in Canada. And we also know that business and public finance interests here in Canada have become dependent on international education. We know that the fees are generally 2 or 3 times more than what a Canadian person would pay to access education at these post-secondary institutions. So revenues support Canadian students to go to school while charging international students much higher fees. And we know that there's actually public colleges that have kind of sprung up to meet this demand and sort of make their profit from this particular model as well. So there's a lot of stress, and the next slide sort of shows that on families making massive sacrifices for this. And these are not high income families. These are often low and modest income families in Punjab who are looking to secure a better financial future. And they think that, sending their child to Canada and having them internationally educated will give them that financial return in the long run. But what is doing right now with these high tuition costs is putting an acute financial stressor on the families in Punjab, as well as the students who are trying to make it and survive with the high cost of living here in Canada, with their families making all these sacrifices. And their sacrifices, there are many anecdotal stories suggesting like families have given up all their savings, they're selling parts of their land in Punjab, like they're giving up quite a lot to make these tuition payments. Again, to add more context to that financial stress, when students come to Canada, they think that they can offset some of their stressors by getting a job. Most of us think that as well, but because of their immigration status and because of some of the context around how badly they need to get that job, they tend to get put into positions where they're vulnerable to labor exploitation, working illegally, working under the table, getting paid in cash, and their employers generally are not always abiding by labor laws. We also know that international students who identify as female are particularly vulnerable because they can be put into positions of sexual violence or, getting paid for sexual activity, which is very, very risky. So that's kind of some context on sort of the financial and other stressors that kind of are contributing to what Punjabi students might be facing when they come here. We know that COVID has definitely also added to the stressors and affected mental health, as it has the entire Canadian population. But this particular subpopulation relied on or relies on informal support systems, going to Gurdwara, going to community areas, going to their school, going to clubs, going to kind of various physical spaces where they can meet and mingle and learn from one another and support one another. And that was very much interrupted by COVID-19, where, people were getting off a plane and heading into a basement apartment to sit there for months on end all alone in a new country. So we know that it really affected mental health and how people were feeling. And we've seen suicides become a disturbing trend among this population. To continue to go on, I'm going to talk a little bit about what we know about the context of substance use in this population. And again, we don't have great data. That was what this study was going to be about. But we know that international students have been noted to use substances both from the regulated and unregulated markets. So that includes marijuana, alcohol, cigarettes, and/or tobacco, as well as opioids, fentanyl particularly. Those who are especially vulnerable to the toxic opioid drug supply are at risk for toxic death given their isolation and the stigma and, of course, health illiteracy, whereby, there are services that are trying to be provided for folks who are using toxic opioids, but a lot of the international students are not literate in the health system and cannot necessarily navigate that in order to receive the support they need. In addition, some come with substance use histories from Punjab, which is something I'm not going to touch on right now, but Punjab itself is experiencing an epidemic of substance use disorder. The main difference is that the drug supply is not nearly as toxic as what it is here. So you have international students who may have been using opioids back in their home town or home country, home place. But when they get here, they think it's going to be the same. But what they end up doing is using a much more toxic supply, which puts them at greater risk. Finally, I want to highlight that there is some data that suggests that drug toxicity deaths among South Asians has been increasing in quite a lot in the last several years since the epidemic was declared. So we know that it's about 250% increase of drug toxicity deaths in this particular population. How many of those are international students? We don't know yet, but overall among South Asians, there has been a significant increase. These are some quotes from a report that was just released this month. I don't have the name here. I'm sorry, I've forgotten the exact name, but I can reference it if anybody wants to know. But again, some of the government is now becoming aware of stigma affecting this population, the labor vulnerabilities, and how employers can sometimes encourage their workers to take illicit substances to increase their alertness. And of course, as I've already mentioned, the government's also starting to recognize that immigration status is really affecting the ability for folks to access healthcare services. So overall, Punjabi international students are a subpopulation of newcomers to Canada who appear to be at very high risk of mental health and substance use challenges, and we have very little data that exists on substance use patterns, initiators, and sequelae. So the purpose of our research study was to better understand the substance use patterns among international students who are here in the Lower Mainland. And our secondary objectives were also to examine the lived experience of these folks who specifically use toxic opioids, as that's an area of interest in terms of policy and, of course, morbidity and mortality with respect to substance use. And we wanted to understand their experience of engaging in health systems and healthcare as well, to see if that was an area that could be changed or evolved in order to support the folks better. The study design was a prospective observational mixed methods design using a survey and interviews as data collection tools. The survey was meant to target all general international student population from Punjab and aimed to capture data on use initiators, patterns, attitudes, beliefs, and severity. And the qualitative interviews, as I mentioned, were meant to understand more about the lived experience of international students who are using the toxic opioids. We disseminated the survey online via social media from partner organizations, who you're going to hear from some of them right now, and offered a $10 e-gift card, and interviews were offered some compensation as well, and folks were recruited via outreach in the Surrey and Vancouver area in places of worship where Team Suda especially offers some of their services. we've had a lot of challenges with data collection, and that's why we haven't been able to present data today. We have had no uptake to do that interview, and we believe that a lot of that is probably because the numbers of folks who meet the inclusion criteria is quite low, but also there's a lot of stigma and a lot of folks are using in isolation. We may not be able to be reaching them. So we're going to plan to reach out to mobile overdose units, to more clinical service sites to see if we can recruit some of those folks. And then we're going to try to do a lot more in-person recruitment for the survey and use our snowball sampling methods a little bit more thoughtfully to try and get folks to fill out the survey a little bit more. On our research team, we've had barriers, including time. And then we perceive other barriers from the population being their time as well as their interests and maybe a lack of perceived benefit, as well as access to a computer or maybe the length of the survey. So we're in our research team trying to figure out how to improve our recruitment, and hopefully we can present some of this data at a future date, because we really want to be able to give numbers to some of the trends that I've just mentioned in this background. So I'm going to stop there in terms of the background and context. And I'm going to sort of shift the gear of this presentation to a panel discussion with Gurkirat Singh Nijjar, Dupinder Kaur, and Kulpreet Singh, who are from various organizations who provide service and support to international students from Punjab. I've asked the three of them to consider these questions, and I'm just going to open up the floor to each of them to offer about a few minutes of their thoughts, ideas, and experiences in relation to these questions. So I'm going to read them really quickly. Tell us a bit about your organization and its work. What is the need and value for international students, and what challenges do you think they face? Tell us a story of someone who you have met and or worked with who uses substances. What are they using? How did they begin to use? Have they accessed any services? And what do you think are a few of the most important and necessary services to support these folks? So I'm going to invite, perhaps Gurkirat, would you be open to starting us off with the panel, telling us a little bit about yourself and answering these questions, please?
Yes, Dr. Puri. Hello, everyone. My name is Gurkirat Singh, and I would tell you a bit about our organization, Team SODA, which stands for Students Overcoming Substance Use Disorder and Addiction Society of Canada. So it is a student-run non-profit organization founded by me and Yashmi Kaur and Hardeep Singh in 2019. As we know, the death toll from drug toxicity was on the rise since 2015. And especially in 2018, like there was so much overdose crisis, especially in South Asian community. So me and my friends got a chance to attend a retreat, which was organized by One Voice Canada and South Asian Mental Health Alliance, where they trained 25 international students with mental health training and how to respond to overdose crisis. So we pulled that small module from our 3-day retreat into a plan or a community plan to go and do outreach at various places in our South Asian community where we can talk to people and where we can raise awareness about drug toxicity. So we started providing culturally appropriate harm reduction, overdose response, and prevention trainings to new immigrants, newcomers, refugees in the Lower Mainland. And since September 2019, we have been holding outreach booths at various parks, places of worship, and have interacted with thousands of community members. So basically our team members, they provide harm reduction educational information and live demonstrations of naloxone injections. And we also provide naloxone kits at our booths. So during pandemic, while adhering to COVID-related protocols, our volunteers, they conducted dozens of booths to increase awareness about the drug toxicity. And during those conversations, we learned so much about the problem, especially from the South Asian context and the Punjabi context. So we have been working collaboratively with South Asian Mental Health Alliance and One Voice Canada, and we have been tailoring our trainings towards vulnerable groups such as international students. And we also host train-the-trainer sessions where we train new international students so that they can help other international students suffering with addiction. So we are trying to take them into a loop where every international student knows like where to go for resources, where to ask for help. For example, we have met several students like having trouble with their alcohol use or opioid substance use. And I would like to share a story where one day I got a phone call from an international student from Punjab, and he was like, his friend overdosed and died in the washroom. And that guy was carrying so much trauma and so much burden of that incident. This is like one of the stories which I'm sharing here, how an international student who is already vulnerable to financial distress, to get good grades in school, to get food on their table. And on top of that, when they come here and they're unaware of the illicit drug supply, fentanyl poisoning happening all over British Columbia. So sometimes like the recreational users, we had one case where a student who just tried opioids just for recreation ended up being overdosing, and that was an eye-opener for us as well, that how little our colleges and universities are focusing on providing this education of current crisis in BC. So I think working collaboratively with universities, government, and health authorities is the key, and seeing what's happening at the grassroots levels. Like we have been trying to convey that message to the government. Recently, we had opportunity to present our work at BC government's health standing committee, and there were some recommendations provided by us which are being mentioned in their report. For example, we found out that some individuals seeking permanent resident status may be afraid to seek treatment and recovery services just because that could be reflected in their medical records, which could negatively impact their immigration status or immigration applications later on down the road. So if we have something in place which protects them, not punishes them for accessing medical services, I think that would help us to save like so many lives, young lives especially. Yeah, I would like to invite Dupinder Sran to provide some information on One Voice Canada's work with international students and how they are tackling different issues like sexual exploitation, work exploitation, which all plays into this mental health crisis and overdose crisis in the bigger picture context. Yeah, Dupinder Kaur, to you.
Thank you so much, Gurkirat, and Dr. Puri and all the others here for having me attend and be a part of this panel, this very important panel to speak on that matter. So I am from One Voice Canada. One Voice Canada has been initiated back as of February 19th, and the reason for having this nonprofit organization come forward and support international students was because when we saw a fluctuation of immigrant students coming here, international students coming here from different countries, we also saw the lack of resources, the lack of support that they were facing in the community. The importance of seeing that lack of support, whether it be resources, whether it be from the community and not supporting the students as much as they should be, we felt that we needed to bridge that gap. We needed to provide them support through resources. We needed to provide awareness on key issues and concerns that the students are facing within the community amongst, presenting to other organizations, collaborating with them, as well as in the community, trying to sort of get over the ordeal of the exploitation that these students were facing. So to prevent further exploitation from happening and getting on board in trying to determine ways and solutions, whether it be through policy means of government, different levels of government, having roundtables with them, whether it means to sit down one-on-one with students and determine what factors are creating the reasons for exploitation. So as some of the other speakers have mentioned here, if we look at exploitation on its own, providing that advocacy for them is very important. So we needed like a strong group of professionals to come together and leaders in the community already who could tackle this concern and bring out that awareness on their behalf, along with the students being on board with us as members, directors and volunteers. And so One Voice Canada has formed a platform where international students can come. They can, either volunteer with us. They can also become directors on board and through experience, as well as we have the professional advisors on the back end who all help them in seeing the importance and bringing around the importance of what is happening, as well as helping other students. So we not only advocate and bring out the awareness, but we give the opportunity for international students to help them become leaders in the community based on what's happening. So there was much of cultural differences going on, the community not being able to understand students at a greater level that they are now, which is, I'm very pleased to say, we did a lot of work over the last couple of years to really bring around that awareness that students need to be fitting into the community. They have a lack of support when they already arrive, the minute they arrive at the airports. There is no sort of resources being provided to them. There used to be a time in Canada where welcome packages were given out when immigrants would come to Canada. That no longer is the case. And so when students arrive at the airport, immediately there's no resource available for them unless they're in touch with somebody, whether it be an organization or another student or a family member out here. And in most cases, as Dr. Puri has mentioned, these students are coming, they're picking up huge loans back home in order to come here, and then they don't have the support system once they arrive. So that makes them very, very vulnerable for exploitation. That makes them very vulnerable to have mental health issues and financial struggles, and the mental health and the suicide, as Gurkit has mentioned. That also makes them more vulnerable for deportation. That also makes them more vulnerable for substance use. So it's always a domino effect that occurs once they are here and they face these struggles on their own. Having each other is one thing, but having that community support and the organizations that are around to help them is another level of support. And so we really try to push and advocate and create this awareness around that these students require the same sort of resources that others here in Canada already have provided to them, as well as the other side is paying the heavy tuition fees 3 to 5 times the amount, but not being able to get that whether it's on the college level, whether it's in the community, not being provided those resources, or having a lack of, or if there are the resources available, which in today's society, we are seeing that there's more available to the students. It's a lack of not being aware of where to find those resources or how to gain access to them. So One Voice Canada provides a lot of that support and bridges with others like SAMA, so South Asian Mental Health Alliance, with Gurkit's organization SUDA, with diversity options, moving forward family counseling services, Roshni Clinic when it comes to substance use, or others, South Asian therapists. There's many organizations out there who have collaborated with One Voice Canada to help out on the substance use side. And a lot of it, as Gurkit and Dr. Puri have mentioned, is mental health. Even if they don't have an underlying mental health disorder or illness to start off with, they typically tend to develop the mental health once they arrive in Canada due to all the struggles and the finances and the financial aspect of things that they face. So right now, inflation is a big thing. Inflation is just, making it even much more difficult for these students to find rentals, to day-to-day living, and not being able to work enough hours, which we really advocated for in the last couple of years. And thankfully now students are able to work the 40 hours in order to help out on the financial side, because there was a lot of mental health issues occurring. And, how long this 40-hour period is going to take place, how long the government will allow that, we're not certain on that, because it is a temporary mean of covering for the employment situation that's happening in Canada as well. So there's, again, different layers and levels. Like, for instance, nothing's been permanently placed out there for students in that aspect. And I feel that these are things that we really need to work on together as collaborative organizations to really push for, because when students face that mental health, that is when they become more vulnerable for the substance use as well. I mean, we've had students who have come to us, just as Gurpreet has mentioned, some turning to alcohol or opioids. I personally dealt with one student who was very suicidal and had to collaborate with another organization such as Roshni Clinic, and then had to actually take him to the emergency room physically myself to get him assessed through the psych unit there in order for him to get the help that he needed, because he just was not feeling supported. He would, go to the emergency room, feel isolated, feel lonely, and then leave, not even get assessed. So these are very important issues and concerns we have when it comes to Punjabi international students, is that sometimes they feel like they don't fit into the culture. Sometimes it's a matter of language barrier. Sometimes it's a matter of, well, what do I say when I'm there? They feel a little bit ashamed of, facing the issues they're facing. So we kind of have to look at them as a holistic approach as to, are they having mental health issues? Are they facing anything at college, maybe landlord-wise, employer-wise? As Dr. Puri mentioned, some of them facing sexual harassment, or some of them for cash turning to drugs themselves. So, being on the drug deal side versus doing the drugs themselves. These are all becoming very key issues in our country here with the students. And I feel like we as community members can do a lot more, and we are trying to continue to do more. And we've been very lucky that, at certain levels now, people are recognizing that the resources need to be there. And like certain societies like Diversity Options hopping on board, or PIC Society, or others that are there now, realizing how big of a concern this really is. If we want to save our international students from substance use, or if we want to save our Punjabi students from suicide, mental health issues, then we do need to come together as a community and get over these barriers. Thank you for that, and thank you for having me present today.
Thank you so much, Tapinder Kaur. I think you've highlighted such a complex sort of interplay of things in your very concise sort of commentary. I'm noticing the time, but I also do want to invite Gurpreet Singh to add anything to what's already been mentioned on this panel. I really appreciate your interest and to join and offer your thoughts so last minute. So thank you. And if you want to also add, there will be a breakout discussion as well. So just in case you're feeling that you may not have the time or space to get into everything.
Thank you for organizing this event, and to all of the team who put this discussion together. It's so important to advocate for these vulnerable communities, especially international students who come to Canada looking for a better life and often feel, as my colleagues have mentioned, isolated and not able to access the resources that they need. I was going to speak to a little bit of the community collaboration, but my colleague Deepinder has mentioned some great examples. It's been very heartwarming and inspiring to see different community agencies and groups and health authorities coming together to try to support the international students. But where we see some of the gaps, like Gurpreet and Deepinder mentioned, are on the systemic level. So when students come here, sometimes they're recruited, like Dr. Puri mentioned, to schools that are pop-up schools. And those pop-up schools may not have the facilities or the capacity to support international students. Like Dr. Puri mentioned, a lot of times these pop-up schools are business endeavors created by business people. And so it may be that they've purchased a curriculum and they're running an institution out of a warehouse, but international students who are becoming victims to this type of scheme, they may not be aware of the scheme. They may not be aware that whether it's an accredited institution. They may not be aware whether they have a full campus. They may not be aware whether they have facilities for international students. And when they come here, it could be as simple as an office in a warehouse complex. So they don't have those access to the services that they need. However, unfortunately, as Tapinder mentioned, even in some of the larger post-secondary institutions where international students pay higher fees, the lack of services available to them in their languages creates those barriers and creates that isolation. So we've called upon in terms of advocacy on behalf of One Voice Canada, South Asian Mental Health Alliance, and SODA. We've met with government representatives and ministers to try to advocate for international students and ask for those systems to be worked on. Having better oversight when it comes to these pop-up schools, having better oversight when it comes to business exploitation of international students who may be in an employment setting and they may be not having access to information about WorkSafe BC or what benefits or what protections they have in a workplace setting. So these kind of things that they don't know when they arrive here, like Tapinder mentioned, that an orientation is so important. So I think that on a systemic level, different ministries like the Ministry of Health, Ministry of Mental Health and Addictions, Ministry of Jobs, and Ministry of Labor, and Ministry of Immigration on a provincial and federal level can create systems in place so that international students, when they come here, they're set up for success, rather than simply recruited to Canada, but then relying on the agencies to support them entirely. So my kind of to address the last question that you have here about most important and necessary services, I think that community agencies and organizations and teams throughout different regions are trying to do their best. But on a systemic level, there are gaps that are missing those international students' needs. And it's almost as if, like Dr. Puri mentioned, is that there's an industry built around this, exploiting the students and using them for cheaper labor, using them for for more rent, and sending those fees to our domestic students, but then not providing the services that are language specific or culturally relevant to the students in those post-secondary institutions. So I think when it comes to what are the most important, I think it's more on a systemic level. Collectively, we can advocate for those systemic barriers to be lifted to make international students' outcomes in Canada better.
Thank you so much. All three speakers have highlighted, I think, a variety of different aspects and angles of the entire situation that we're discussing today in the dialogue session. So I humbly thank you all for bringing your experiences to the conversation, and for everybody listening to, give that space and time to absorb all of what they shared with us. We have just a little bit of time left in this particular session, and we invite you to get in contact or in touch with us if you have more thoughts or questions around what we've said so far. But I wanted to offer the rest of the attendees at this dialogue session a little bit of a chance to offer your thoughts and consider some of the key questions that are coming out of this conversation. So we just have about very short amount of time for breakout rooms, but I'm going to invite you to take a look at these questions, and then I'll pass it over to Veronica to just let us know how we can choose which room you want to jump into. So the first question is, how do we make health services equitable for international students? The second is, how can learning institutions better support international students and their mental health and substance use? The third question is, how might Canadian systems culture and the COVID-19 pandemic influence in international students' use, and what systemic and cultural changes could we consider? And some of the panelists have mentioned a lot of their thoughts on this question already, but we can do it together. And then finally, who needs to work together in order to support international students who use substances, both within, within universities, within schools, as well as on a broader systemic scale. And then how do we leverage and build those necessary connections? So I'm going to invite everyone to pick a room. It looks like there's more information in the chat, and then you can click on the Jamboard, which will allow you to offer some of your thoughts. We have a few minutes to just sort of highlight what happened in those breakout rooms. So I'm going to share my screen for a couple of minutes and invite anyone from each of these great breakout rooms to tell us what it is that they talked about. So I've got room 1 here, which is how can we make health services equitable for international students? Does anybody from that room have any comments beyond this? What you see on the Jamboard? There's talks about culturally tailored services, representation in policy, making healthcare easier to access financially and time-wise. I see room 2, how can learning institutions better support international students and their mental health? Does anyone from that room have anything to contribute here? I don't see anything on the Jamboard.
Yeah, sorry, I think we were just too busy talking
Awesome.
and grappling with some very complex issues. And I think probably the sense we got is that universities aren't thinking specifically about substance use and mental health when it comes to international students as a population. They're thinking sort of more generally about the student population, and that they should all watch this panel.
Thank you. Thank you so much for that comment. The third question was how Canadian culture and the COVID-19 pandemic influence substance using journey, and what systemic and cultural changes could we consider? I know the panelists mentioned some of this, but curious what the breakout rooms thought.
I think it was me and Jang Bahadur Singh in that room, if I'm not wrong. And we actually had a side conversation regarding the how to recruit more people, especially from South Asian community for our qualitative studies. And it seems as if so many people who are doing qualitative studies, they're having a similar challenge where they're having like difficult time in getting participants for research. So we talked about like what are some factors people are not willing to participate in the research, and we found out that there is a lot of stigma and like a lack of awareness as well. Like for example, for substance use, even though we had people who were like, oh, we will give you a phone call later on, maybe in 1 week for the interview, and we never hear anything from them later on. So maybe like it could be, so it was an idea of, I forgot the name, like Jang Bahadur Singh. He said like maybe this could be an entire study in itself to learn more about how to have best practices for recruiting people for qualitative studies. So I think it's a challenging theme, and we have very little information about this aspect.
Yeah, most definitely. And I will also say it's not just a Punjabi or South Asian. It's actually, this is a common phenomenon for people who use substances too. So there's something about the actual disease of addiction, I think, that also contributes to challenges around recruitment into research studies. And that makes sense. Folks who are using substances actively, especially toxic opioids, they generally have a variety of challenges on, a daily level for executive functioning and getting stuff done. So it's hard to join a research study. There's just so many other priorities for a lot of folks who are in that position. So it's a crossover culture, as well as the disease process itself, I think, contributes to that. I've got here the last question, who needs to work together and how do we build those connections? It says here, everyone needs to work together. So anyone have a last minute thought about this particular question?
I'll just say quickly that we talked a lot about the fact that there's the cultural sensitivity is important, that there are resources that universities need to be thinking about, things like having people who speak the language of the international students, the home language of the international students, that have some background that is similar, so that there's some connection there. But ultimately, and to be aware of the community-based resources that are working with international students outside universities. But really, in the end, it's about drawing in every possible community connection and resource that's available to help, because this is a pretty complex, multi-headed sort of problem.
Yeah. Thank you so much, Kim. And thank you to everyone who participated in the talk today. The nutshell basically here is that international students from Punjab experience a multitude of migration-specific stressors that put them at risk of developing mental health and substance use disorders. Despite this, their ability and motivation to access health and other social services is limited. We need more data to better understand substance use patterns and sequelae in this population, despite significant research recruitment challenges. And in addition, novel healthcare interventions that are culturally and vulnerability specific may work to better support those who are suffering. So with that, we'll probably conclude the dialogue session. If you have any questions or comments or want to continue the conversation, there is the contact information for those of us who are on the actual research team. And I really, really thank you all so much for participating in our talk today. I'll hand it over to Kim.
Thank you, Natasha, and thank you to the rest of the panel as well. And I just want to make sure that you're aware of the next session in our dialogue series, which will be on Friday, January 20th, and it will relate to post-COVID-19 pandemic long-term care delivery. And please do sign up for the UBC Health newsletter so you're aware of the other events and activities that are taking place. And thank you again for being here today.